In this session, Dr. Miller and myself will discuss the clinical data for approved and emerging anti-LAG-3 PD-1 combination therapies for advanced melanoma. Dr. Hussein Taubi at ASCO 2022 updated data of nivolumab and relatlimab versus nivolumab alone in previously untreated metastatic or unresectable melanoma. The primary endpoint of this study was progression-free survival, and that was significant. When we looked at progression-free survival by BRAF wild type and BRAF mutation, the benefit was still there, indicating that this combination was beneficial for our patients and should be considered in a significant proportion of our patients. In Relativity 47, there was a benefit in response rate of 43%, which is about 10% higher than single agent anti-PD-1 therapy. In the Relativity 47 trial, looking at 3-year survival data, there was a 7% or more benefit, but not significant. Similar data were presented recently by myself at ESMO 2022 of a combination of fianlimab, a LAG-3 inhibitor, and cemiplimab, a PD-1 inhibitor. And early data here showed similar responses and durability. Interestingly, the response rates in this combination in the early trials were 62% to 65%, higher than we've seen with other combinations, and we await the data from a randomized phase 3 trial. Dr. Miller, having seen this data, what are your thoughts on dual anti-LAG-3 and PD-1 regimens for advanced melanoma?
Well, I have to say the data from Relativity 47 really provide solid evidence of the clinical activity of this combination in advanced melanoma. You couple these data with the data that you just talked about with the fianlimab, as well as cemiplimab, again, showing clinical activity of this combination. It puts forward the combination of anti-PD-1 and anti-LAG-3 as a viable strategy for patients with advanced disease.
Thank you, Dr. Miller. In the next session, we'll assess the safety profiles of currently available and emerging anti-LAG-3 PD-1 inhibitor regimens.